Hello, everyone. Greetings, everybody. I'm Priyanjali from Beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You have come across people, especially women, with brown colored patches on their face. They seem like freckle like spots forming large, flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to study conducted across four Indian cities, revealed that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more susceptible to pigmentary disorders. It occurs mainly in women, which is 90%, and 10% of all males of all ethnic and racial group. According to 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation generally is ignored as a sign of aging and often is misunderstood as a skin condition. Melasma sufferers has been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustration setback in treatment. To avoid all these hassles and to keep you informed today, we are here to know more about the management of melasma from our expert, Dr. Abhyuday Tiwari from Gwalior. Dr. Abhyuday Tiwari, he's an MBBS MD and is a skilled dermatologist and cosmetologist practicing at Apex Hospital in Gwalior. With expertise in both medical dermatology and cosmetic procedures, Dr. Tiwari is dedicated to providing comprehensive skincare solutions to his patients, ensuring optimal health and aesthetic outcomes. Today, we are privileged to have him with us. We extend our heartfelt gratitude to you, Doctor, for joining us. Without further ado, over to you with the first question, Doctor. What is melasma?
Melasma, I think you have already given a pretty good description of melasma.
Right,
Uh,
right.
but to give a very bookish description of it, it is an acquired
Hmm.
pigmentary disorder, which means that it never was there in the first place, but in course of time, someone gained it and it presents itself as hyperpigmentation mainly on the face.
Right,
That's the most basic description of melasma. And the nuances, like how is it different from other hyperpigmentations on the face, because there are other types of hyperpigmentation. That is where the difference lies in, depending upon the history, how it came to set in, the exact locations. It has very typical locations about it, which I feel in the upcoming questions I'll be able to explain better. But
right.
just know that the hyperpigmentation on the face, which occurs on the cheeks, the forehead, the nose, upper lip, or the jaw, and if it has occurred during pregnancy or post pregnancy, or if someone started oral contraceptive pills or hormone therapy, in those cases it is most likely melasma. Of course, you need to go and see a dermatologist who can diagnose it for you, because it can mimic other conditions also. Other conditions can look like it, so there can be some confusion regarding that. But overall, this is the basic description of melasma: hyperpigmentation of the face.
Right. Moving ahead, डॉक्टर कोई भी कंडीशन हो या बीमारी हो डिजीज हो कुछ भी हो
Mhm.
recognizing or understanding the disease is the
Hmm.
main part, is the most
Hmm.
important part. So
Hmm.
we know a lot of people who has freckles. I personally have freckles. So how
Hmm.
do one differentiate from melasma and freckles? How does the initial stage look like?
What I have seen is that even in Indian skin, there are very rarely, freckles are not that common.
Hmm.
Second of all, freckles, the size of the freckles is usually less than 1 centimeter. Whereas in melasma, there are large confluent patches. You will have huge patches on the face, large areas getting covered. Third, freckles don't have a pattern. If they occur, they can occur anywhere and everywhere on the face.
Hmm.
Melasma most commonly will prefer the cheeks, the nose, the forehead. One more thing, freckles have a tendency to occur in adolescence, in young age. They don't occur during pregnancy,
Hmm.
right? If they have to occur, if the skin has a tendency for it, they'll start to develop in your early 20s or adolescence also. They just won't randomly occur in your mid 30s or mid 40s. Whereas
Hmm.
melasma will typically occur then and there only. Freckles can occur in both men and women. Melasma, 90 to 95% cases are women only. I have only one case of melasma in a man, and rest all the 20, 25, 30 cases I'm treating, they're all females. So that's how it. But the most important thing is the size. Your
Hmm.
freckles, which are called ephilates, they are light brown in color and they are less than 1 centimeter. If you
Right.
have
So,
multiple, hmm, hmm,
so because you have mentioned about the size, doctor, does the size form from a small dot and then it starts spreading, or
hmm.
it's just a patch which starts,
It's
enlarging more and then spreading more?
it has a mixed presentation. It can start as a at one cheek. It can start as a spot which grows in size.
Hmm.
At the other cheek, directly a patch can start forming, and the patch is more than 1 centimeter, and macule is less than 1 cent. I won't go into these terminologies. There's no need for that. It can start as a small spot and grow into a large patch, or it can directly start as a patch. But the most important thing is symmetry. Melasma is always symmetrical. The size
Hmm.
of the patch on one side will be similar to the size of the patch or the macule on the other side. It will have symmetry, whereas your
Hmm.
freckles are not symmetrical. They don't follow a
Hmm.
pattern on
Hmm.
the face.
Right. Right. So, what can be the cause behind it, apart from pregnancy, which you have just mentioned, or oral contraceptive pills?
It is mainly hormonal. It is mainly pregnancy. During pregnancy, the altered hormonal profile stimulates the melanocytes. The melanocytes
Hmm.
change in structure. That's the whole problem. They change in structure and they start producing more melanin. Now, why exactly at these particular areas only, and that to the face, is the question.
Hmm.
Why is it only
Hmm.
affecting the
Hmm.
face, not the whole body? Well, research is happening and no one truly knows about it. But biopsy, when it was done for the patients, multiple biopsies have been done, many research studies have been done. They only found one thing: hyperactive melanocytes, which are getting stimulated during the pregnancy and then they remain persistently hyperactive.
Hmm.
Earlier, they
Hmm.
were not hyperactive. During pregnancy, they became hyperactive, and once the pregnancy is done, then they remain hyperactive throughout. They remain persistently hyperactive. So, why exactly these course of events are being followed? We can only make guesses and logics or give theories, but exactly it has not been proven.
Right. So, because we are talking about it, so let's talk about the preventive measures as well. For such patients, are there any preventions which they can take before the pregnancy, maybe?
First of all, during pregnancy, at any point of time, you start noticing hyperpigmentation of the face, and not occurring on the entire face, only certain areas, and you can just start making out this part of my these parts of my areas have started darkening. So once that
Hmm.
happens, you can immediately consult a dermatologist, go and show it to him or her, prevent it from spreading further. Right.
Hmm.
Most cases realize so late that it has already set in completely, and then it's an uphill battle. You have to start the treatment. It's going to take months. Why not start a sunscreen immediately, only on those particular parts which are darkening? Go and see a dermatologist. If he can give you a skin lightening agent, you can directly start that. But if you are asking
Right.
me ki, during pregnancy when it is in developing stage, can we put a halt to
Hmm.
it even then and
Hmm.
there?
Hmm.
No, we cannot. We can only prevent
Right.
it from spreading further, but we cannot stop the process.
Right. Right. Moving ahead, doctor, initially you mentioned about hyperpigmentation. So, what is the basic difference between melasma and hyperpigmentation, or is it the same?
Melasma is a type of hyperpigmentation. Basically, in our chapter, hyperpigmentation is a big list. Disorders of
Hmm.
hyperpigmentation, what all conditions give hyperpigmentation. So, melasma is one topic in that 30-page chapter. Melasma is one of the hyperpigmentations, and there are other conditions also, like post-inflammatory hyperpigmentation. Then we have drug-induced hyperpigmentation. Then we have, due to hair dyes also, melasma-like spots can occur on the face. It's very common. It's called Reals melanosis. But in a 20 or 30-year-old woman, it's very hard because they are usually not on hair dyes. That starts
Hmm.
happening post 40.
Hmm.
and we have nevus of ota like macule. So there are other 4 5 conditions where you can see melasma like spots, but all in all, the it's not a different thing, it's a part of something. Melasma is a part of disorders which show hyperpigmentation.
Right. So we can say that all melasma can be hyperpigmentation, but all hyperpigmentation is not melasma. Maybe we can say
Yeah.
that.
Yeah.
Right. Moving ahead with the next question, doctor. What are the risk factors of melasma?
Being a female, I think that's the number one risk factor. Second is, of course, pregnancy, which is going to happen. So that's the biggest risk factor.
Hmm.
When you say, it's very popular to say that it is UV rays induced, right? Or OCP induced, but the thing is, these are just exacerbating factors, something which will trigger melasma in a person in whom it was destined to happen. If someone is
Hmm.
destined to happen melasma during pregnancy, that weakness in that particular environment in the face will be created where melasma can develop on exposure to UV radiation. Now you cannot stop going out in the sun. You cannot stop
Hmm.
using your screens. UV rays will
Hmm.
come, affect your face. The melanocytes will get triggered, and it will happen. Of course, women who are on OCPs also it can get triggered. But again, what are OCPs? They are hormones only, right? OCPs are
Right.
hormones. So
Right.
if someone has a predisposition for developing melasma, hormonal changes, UV radiation combine together to generate this.
Well, doctor, can melasma significantly affect a person's self-esteem? And
Hmm.
can you talk about the psychological impact of this condition that can have in anyone that maybe we should address?
Most women who come and seek treatment for melasma is because of appearance. Nobody
Hmm.
wants their skin to change or their appearance to be altered to such a degree where they look different. It creates mental stress. Second of
Right.
all, pigmentation, darkness, it's a huge problem in India. Everybody wants to look fair and have a glowing skin. And not just in India, abroad also, everywhere everybody wants a
Right.
glowing fresh looking skin, and when melasma sets in, it covers a significant part of your face. So if a woman consider herself unattractive, her self confidence goes down a lot. Now what the problem becomes is that they stop engaging with people, stop going out to functions. When they're going out in functions, they're applying a lot of makeup. Then they are going to different doctors who can help them out, who can bring the pigmentation down. And their frustration is understood. Even if you or I, any one of us develops melasma, we are going to seek treatment for it. We are not going to like it. And the problem with melasma, it doesn't get cured, and they are seeking a cure that so they get rid of the headache. So they start obsessing over it also. Then they start observing themselves in the mirror also, and it becomes a vicious chain, vicious cycle where they are unhappy with their look a lot. Some women are not
Hmm.
like that. They are able to accept it normally. Okay, I developed pigmentation, can't do anything about it. But there are some women who start obsessing over it. So with them, it becomes a significant source of mental distress. And the condition is not life threatening at all. It's just appearing a cosmetic appearance. But see the amount of psychological distress people develop. So
Hmm.
they suffer from a poor quality of life.
Right.
They're not
Right.
happy with
Uh,
themselves.
Well, you have already mentioned that apart from the distress, the psychological distress, there is no other health risk from
Hmm.
melasma. But
Hmm.
can it also spread genetically? Is it possible, especially for women who are
Hmm.
facing while during their pregnancy? Is it possible that the child can also have it?
No, child cannot develop it, but the thing is, it doesn't work like that. Whoever is watching, your child cannot develop melasma because your child does not have, especially a girl child, your child just does not have the hormones which can trigger melasma, first of all. Second of
Mm-hmm.
all, melasma will get triggered during the pregnancy time. The
Mm-hmm.
age is 30 plus, age group is 30 plus, or even during 20s, if pregnancy happens, young marriage, you married at a younger age,
Mm-hmm.
your child, your relatives, your parents, if there is a chance that your first degree relative or your mother or your cousin or your sister, real sister, developed it, then there is a chance. It has not been exactly given a percentage, it keeps on varying in different researches and books, but there is a chance you can also develop melasma. But if your girl child can develop it, that remains to be seen. She may or might not develop it.
Right. Right. So, we are saying that there is no way that we can stop the initial stage, like from it appearing. There is no way.
Thing is, it's like you you can put a break to the cosmetic appearance, that from further this will not expand further. But the
Hmm.
thing is, the skin has already changed from inside. The melanocytes have become hyperactive. So
Right.
if we use sunscreens, we can improve our cosmetic appearance, keep it in check. But the
Hmm.
moment you try to leave sunscreens or a lightening agent or whatever agent you might be using, the process will again start showing on the face. So using a sunscreen and a skin lightening agent as a part of routine skincare becomes important in that case, because then you can stay at home,
Right.
give yourself, treat yourself, self medicate, and
Hmm.
you can maintain a good look.
राइट सो बेसिकली जैसे आप लोग सुबह डेली उठते हैं और ब्रश
Hmm.
करते हैं वैसे ही
Hmm.
अपने रूटीन में ये सारे स्किन केयर रिजीम्स आपको इंक्लूड करने हैं फॉर द रेस्ट ऑफ योर लाइफ ये आपको
Yes.
सोच लेना है इन
But
केस
hmm.
अगर आप अपने चेहरे से या चेंजेस से थोड़ा सा झिझक
Hmm.
रहे हैं तो अदरवाइज
Hmm.
इट्स ऑल योर चॉइस मूविंग है डॉक्टर ट्रीटमेंट ऑप्शंस के बारे में अगर हम बात करें क्या क्या
Hmm.
अवेलेबल ट्रीटमेंट ऑप्शंस अभी है करंटली
Treatment options कई सारे हैं, there are many. I personally use tranexamic acid in injectable form, and I use one skin lightening agent which usually contains a mixture of hydroquinone, glycolic acid, and along with that a 50 SPF plus sunscreen. I always advise use a sunscreen which is at least 800 rupees or 700 800 rupees. For melasma, use a silicone based sunscreen. It is thicker, it has more physical agents in it, so it provides a much better sunblock as compared to a 400 300 rupees based sunscreen, because they are water based, and when they spread out they don't form a thick coat which is required for a good sunscreen to form. I experienced this with certain patients who were on a budget, so I prescribed them. I won't take name of the sunscreen, but the results were just not moving. And suddenly, when I switched to a silicone base, they suddenly started improving. So I think the limiting factor in their treatment was the sunscreen only. And hydroquinone is the main agent for sunscreen. It is still the first line and the gold standard for treating melasma, but it has its own side effects. It cannot be used for a long duration of time. It produces good results. Then there is something called as a triple combination cream. Klickman's formula, which contains tretinoin, a steroid, and hydroquinone. Yes, and hydroquinone. But again, the problem is it cannot be used for a long duration of time. If you use it, your face will start developing side effects of the steroid and the tretinoin. And
Hmm.
again, hydroquinone cannot be used for more than 6 months. So you are stuck in a cycle. Right. So you use these
Right.
strong potent agents for a short duration, get the
Hmm.
clearing, stay in the safe zone, and then move on to a
Hmm.
healthy skin lightening agent which cannot produce side effects. And
Right.
once you achieve a significant amount of lesion clearing, the person themselves feel quite mentally satisfied, and then they can self medicate at home by using the same creams continuously. And over time, if you use it for 9 months, 12 months, the lesions will clear out. It's not like they don't clear out, they just take longer, and
Hmm.
certain amount of patience is required.
Right. Right. Well, apart from these medications which you have just mentioned, any
Hmm.
other treatments which are available for the patients who are severely, hampered by melasma, maybe we can say.
Thing is, I saw the question section, and in my experience, I don't want to discourage anyone. I don't want to break protocols, treatment protocols of any other person. But when it comes to melasma per se, I can use chemical peels. They do help.
Hmm.
4 to 5 sessions can be done while hydroquinone is being initiated, and you are giving tranexamic acid and you're using your sunscreen. Peels are safe, so you can keep on doing them.
Hmm.
Right? They alone themselves don't have any effect. They
Hmm.
might have in someone, but when we talk about the general patient population, so what works in everyone is not chemical peels. They are an accessory treatment, not the main treatment. You
Right.
give the main and add chemical peels to it, very good combo. If you remove
Hmm.
chemical peels also, main treatment is a good combo, but only chemical peels doesn't work. Then
Hmm.
coming to lasers, we have Q switch lasers. Q switch lasers have to be used in a particular mode, low fluence setting, they have to be used. Again, it is an accessory treatment. If you have the budget and you are good with money, then I feel you should go with all the treatments all together. Get a peel done, get the laser done, use all the other agents that are possible. That might be costly, but it's okay. If you're on a
Hmm.
budget, you can let go of the laser part, only focus on the medical treatment and chemical peels. You're on a stricter budget, just go for the medical treatment. All other
Right.
treatments except medical are accessory treatments. They don't have any effect on their own.
Hmm. Well, for the people who are listening or who can see us right now, आप सभी के सामने सारी बातें सामने रखी जा रही हैं, पर ये मत सोचिए कि आप सेल्फ मेडिकेट कर लेंगे आपको, बिकॉज सबका
Hmm.
कंडीशन अलग है. वी आर टॉकिंग अबाउट दिस टुडे, बट यू डेफिनेटली हैव टू विजिट एन एक्सपर्ट सो दैट आपके इशू को, आपके कंडीशन को इंडिविजुअली वो जांच के आपके हिसाब से आपको सजेस्ट कर पाए. सो प्लीज डू नॉट गो फॉर सेल्फ मेडिकेशन, जो हमेशा हम आप सभी को कहते हैं. दिस इज नॉट द
Hmm.
राइट वे टू डू इट.
Hmm.
मूविंग है डॉक्टर, there are some misinformations about melasma and hyperpigmentation. Can you enlighten any one of them? Or we have also heard that melasma can turn into cancer. Is it true?
This is not at all true. Cancer cannot happen in melasma. It's just overactive melanocytes, nothing else.
Hmm.
Then there are certain myths that one of the myths you only said, can it happen to my child or can it happen to my daughter?
Hmm.
So
Hmm.
yes,
Hmm.
there is a 20-30%, 50-50 chance it might happen. That remains to be seen. That's not there. Then one second. Then some people, yeah, coming back. Then some people say, is it hereditary? So of course, the hyperactivity is there in the skin that gets triggered due to hormones. So there is some genetic component to it. Otherwise, it would be happening in every other women around us, but it's not happening. Then
Hmm.
some people say, is it due to some kind of allergy or is it an infection? No, it's not an infection. It's not an allergy. I've already told you hair dyes can cause an allergic reaction on the face, which looks like melasma but is not melasma.
Hmm.
Right? It's melanosis I already mentioned. So that is allergic. And sometimes differentiating between reals and melasma can get, you cannot differentiate at a first glance. They look very similar. I've seen cases, they look just similar.
Hmm.
So that is there. Then yes, in some cases melasma has regressed after menopause, because as soon as the hormones started going down, the melasma started
Hmm.
regressing and the skin became clear, and I think more than 90% melasma got cleared. As not think, as I remember. So I've seen many cases
Hmm.
where melasma gets cleared post menopause.
Right.
Then these are the main myths I feel, nothing more.
Right. Doctor, there are also a lot of people who uses over-the-counter steroid creams or say
Hmm.
fairness creams, which lead to serious side effects. Can you explain the risk associated with these creams and why they should be avoided?
The thing is, these creams, if you talk only about steroid, purely steroid creams, some chemists, dish out just purely steroid creams. So
Hmm.
they though are just not going to work on melasma at all. Patient wasting the
Right.
money, wasting time, producing steroid side effects on the face, which we call a
Hmm.
topically steroid damaged face. A damaged face, the skin will become so thin that it cannot tolerate sunlight. It cannot tolerate hot weather, hot fumes over the face. All right, it will keep on itching, keep on giving burning sensation. You can see small blood vessels on the face. The face looks very red. I've seen some rural women, or some, I don't want to categorize people on the, but some low middle class or lower income group people, they love that rosy look on their face which the steroid gives. Right.
Mm.
So but the whole problem is they develop TSDF after it. Then coming to tretinoin in itself is a skin drying agent. Tretinoin was not meant for melasma, but in combination with steroid and hydroquinone, it produces amazing results. But everybody has applied it for months, and post beyond 6 months, you cannot give Kligman's formula because hydroquinone also produces permanent pigmentation on the face, which mimics melasma. So if a patient comes and their melasma is not improving and they have done medications, I sometimes get confused whether they have used hydroquinone or not, and they don't
Mm.
remember the name of the medication of the company. Not everybody is literate or has the time to read
Right.
the ingredients. So sometimes melasma is not improving. Why? Because it's actually the hyperpigmentation of hydroquinone hyperpigmentation which has set in. So these are the side effects which I have come across, and then first 2 to 3 months I'm just trying to repair the face so it can tolerate my treatment. Once the face gets repaired, then I initiate the melasma therapy, and most of the patients are very cooperating. Most people are very cooperating. They have the patience to go through that, but there are certain, of course, there are certain patients who don't have so much patience. So for them, I'm not able to do much. I just let them know that this is how the treatment is going to go, and if you join me in this journey, then results will happen. But you just need to have certain amount of patience. That's it. So I advise everybody. So like when you are beginning your treatment, do not self-medicate yourself because then it will produce side effects. Then the dermatologist first have to repair you so that you can tolerate the treatment of melasma, and then that treatment of melasma will take so much more time. So if
Mm.
the treatment is for 6 months, you are stretching it to 9 months, 12 months. So why create so much hassle for yourself?
Mm. Well, we absolutely understand the thing which you are mentioning, doctor. But for all those patients, yeah, melasma sufferers, as we can say, a little out of the context question, हम इंडियन सोसाइटी से बिलोंग करते हैं. We always try to apply हमारे घरेलू नुस्खे जो हमारे होम रेमेडीज है. हम कुछ भी हो, फेस में चेंज हो, स्किन में बदलाव हो, we try and apply those घरेलू नुस्खे. So, are there any home remedies for melasma as well?
No, the thing is that even if you apply that multani mitti, it does not have any effect other than dermabrasion. It just opens your pores. The small silica
Hmm.
particles open your skin. Then some people apply basin. So basin, though basin is used food. You don't, it doesn't do anything to skin. Oils, nothing works. Then there are so many combination treatments that come, herbal medications that come, they contain so many ingredients. First of all, nobody knows whether they contain those ingredients or not. Quality drug testing has not been done. Second of all, do they work in melasma? No research has been done. Then there are skin lightening agents, alpha arbutin, all those things. But the thing is, in Gharilu Nuska, they might, if they are present, they might be present in such a small amount, microscopic amount, that it cannot produce a clinical result. It cannot do
Hmm.
anything on its own. What medications we give, they are concentrated in good amounts with that particular agent or compound, so it's able to act on the condition. How can a Gharilu Nuska have the quality ingredients in the right amount? So Gharilu Nuska are good for psychological satisfaction that we are
Hmm.
doing something, but other than that, no. Melasma is a disorder. You cannot treat disorder with Gharilu Nuska.
Right. Doctor, any dietary changes which the patients need to, maintain during the procedure?
During the treatment course, right?
Yes.
All I would say is, if you are that one person who has applied topical steroid creams beforehand, I advise them to eat a lot of fruits, take multivitamins, because vitamins A, C, and E, they will help in repairing your skin faster. Other than that, for melasma, dietary changes have no effect on melasma.
Okay.
It
Then
will
I can
stay.
see some questions coming up from the viewers. Doctor, the first question comes from Rohit, who asks, can
Hmm.
melasma be treated with chemical peels?
It can be, as I have already mentioned
Yes.
it, chemical peels combined with the medical treatment to form a complete treatment protocol. Only chemical peels will not work no matter how hard you try. It will
Hmm.
just not go.
Right. Rohit, I believe you have got your answer. The next question comes from Yash, who asks, can melasma reappear after treatment?
Yes, that's why once you are done with the treatment protocol, you have to keep on using a sunscreen and a skin lightening agent for maintaining your results. Instead of applying a
Right.
cold cream or some over the counter medication which you took and feel happy applying, just apply a proper medication, anti-pigmentary medication. That's it. It will
Right.
reappear.
Right. So, doctor, what if the patient is not accustomed or used to applying sunscreen on a daily basis, and he or
Hmm.
she is moving out in the sun? How can the sun affect the skin, especially for the patients of melasma?
Thing is, sunlight and sun exposure causes a generalized tanning. It's the
Hmm.
ultraviolet D rays which cause the generalized tanning of the face. The thing is, for a melasma patient, the patches will get darker and the remaining skin will get tanned. So the contrast ratio between the lesion and the normal skin will remain the same.
Hmm.
However, if you're applying sunscreens, I tell he or she, the patient, that only apply the sunscreen on the melasma. Otherwise, what will happen is if you use the sunblock in the
Hmm.
entire face, sunscreen sunblock on the entire face, your remaining skin will start lightening, your melasma will also start lightening. So the contrast ratio, which was like this, will remain the
Hmm.
same despite applying it on the entire face. So your melasma won't appear to have improved.
Right.
So only apply sunscreens on your melasma, first get that corrected, then you start applying it on the entire face. Don't apply
Right.
normally, just on the lesions you have to apply.
And how much to apply, doctor? Is there a quantity they should
The thing is, it's called 2 milligram. The what's written in the book is 2 milligrams per centimeter square. How much it should be applied per centimeter square, 2 milligrams. But the thing is, nobody can measure that, and I think it's very impractical. These are just guidelines. Nobody can do that except in
apply?
some big research house where they, some kind of machine is applying it on your face.
Hmm.
So
Hmm.
just when you're applying a sunscreen, just make sure that you form an even on your effect. Like if this much melasma is there, so only on the melasma you apply a coat which of the sunscreen which is visible.
Hmm.
The sunscreen should be a little visible. There are transparent sunscreens also, right? Transparent
Right.
sunscreen, or the sunscreens which match the skin color, those pinkish colored sunscreens, they are good for normal skin. For melasma, there should the sunscreen, we should be sure that we are giving a sunscreen only for skin lightening, for the lesion lightening.
Hmm. Hmm.
We
Hmm.
are not going for a basic sunscreen. It should have titanium dioxide, it should have zinc oxide, physical agents, chemical agents mixture. That mixture will always be colored. There should be no
Hmm.
shame in applying a sunscreen which is colored. Transparent sunscreens, general use, good. Melasma, no. They are chemical based sunscreens, and chemical sunscreens I'm not a big fan of. I always go for a physical plus chemical mixture, and predominantly physical. If you remember cricketers Virat Kohli and Rohit Sharma, what do they do? Have you seen the sunscreen? Their entire face is white. Those are
Yes.
physical
Yes.
sunscreens. And Virat Kohli looks
Hmm.
good. Why? Because he uses physical sunscreens. So I'm not a fan of chemical sunscreens. But okay, there are so many sunscreens in the market.
Right. Right. Doctor, we are talking about sun here, but what about the people who are sitting in front of the screen the whole day, the entire day? Maybe we have a lot of social media creators nowadays. They are very much exposed to these lights in front of the screens. So, can this be harmful for them as well?
I've heard this talk before that sitting in front of a TV or a laptop, it emits ultraviolet radiations, and that can also trigger melasma.
Hmm.
What I want to say is stop thinking so much. Just apply your sunscreen, get the work done, get your lesions cleared. Once they have cleared enough, then only apply sunscreens once you're going under the sun. And at least once a day, you just apply your sunscreens. If we say ultraviolet
Hmm.
rays, then our phones, they're emitting radio waves and whatnot is happening with our bodies. Plus, the
Right.
screen, they have certain parameters of how much ultraviolet radiation they can give, they cannot give. Right. We cannot go into so much science of it. Once you are leaving
Hmm.
home, apply your sunscreen, let it be there, let it sit on your face while you are working. If you're going out for lunch or you're going back home, just apply it once more, head out. It's a very
Hmm.
reasonable regimen, a very reasonable thing to do. And I don't care about laptops. Even if they are giving UV radiations, what to do? You can't stop using such devices.
Well, I believe all our viewers are loving today's live because everybody can relate to what we are talking about today. Speaking about melasma, we are in discussion with Dr. Abhyuday Tiwari, and we are talking about how we can manage melasma. And the next question, which comes from Firoz Khan, who asks, what is the role of lasers in treating melasma?
Lasers have zero role in melasma actually.
Hmm.
To be very honest, lasers don't work in melasma. They say lasers can work in melasma. Of course, it can work if you are already giving a good medical treatment. The patient is regularly following the protocol. So, if you add laser to it, maybe 10 or 15%, you can increase the result of the laser. The laser can
Hmm.
increase the efficacy of the treatment. It can, increase the effect of the treatment, but laser in itself, I've tried in 10, 15 cases, it didn't do anything. So, a melasma is one condition where I feel only chemical peels can help. Some people are trying microneedling, some are trying PRP also in this for improvement, but what good role they can have? Logically speaking, they are just not affecting the pathology of melasma. Of course, lasers can work, but I have not seen them working, and they can only be used along with medical treatment, just like chemical peels. On their own, they cannot do anything.
Right. The next question, doctor, comes from Pooja, who asks, can melasma be caused by other medication?
Yes, it can be caused by doxycycline, amiodarone, then antimalarials. They can cause, but that is not called melasma. Then it is called drug-induced
Hmm.
hyperpigmentation. It
Right.
Melasma cannot be caused by medication. It can be caused by OCPs. Yes, medication, OCPs, oral contraceptive pills can cause them. But other than OCPs, if any drug is causing pigmentation on your face, that is called drug-induced hyperpigmentation.
Right.
OCPs are not drugs; they are hormones, right?
Hmm. Hmm.
Drug compounds, many are there, and those pigmentations get reversed once you stop the medication. Over time, they start clearing out. Then
Right.
one compound I would like to say is hydroquinone, the treatment for melasma, the gold standard.
Hmm.
Hydroquinone itself causes hyperpigmentation on the face. On wherever you are applying, it will darken the melasma if you use it for many months. And it's called exogenous ochronosis. It's a completely different condition, but it will mix with melasma. So you will think my melasma is not improving; it is worsening. No, melasma is not worsening. Another condition has started. Another pathology has started because you overused something. So that is something to be kept in mind. Do not play around with the medications. Most of them have some kind of side effect going on if used for too long or too much. So mixing and matching, that is left to us, the dermatologist.
Right. Well, Pooja, I think you have got your answer already. The next question comes from Akansha Puri, who asks, is melasma life-threatening?
No, it's not life threatening. It has no link with your internal health, nothing like that.
And Okay,
If
then the next question comes from somebody which whose name we don't know, and the person asks, "What are all things that can keep far away from melasma?"
how you can
Let us
prevent
know what
melasma.
all things can keep. Yes.
So how you can prevent melasma? What all things can keep us far away from melasma, right? First of all, don't get pregnant, don't have kids, but that is not possible, right? So what to do? So next thing is you can start using the sunscreen as soon as your pregnancy starts, and hopefully the UV rays during that particular sensitive time, the UV rays will not be able to trigger your skin. Once you exit pregnancy and lactation, then you can stop using sunscreen. No, that is an interesting idea. You can start using sunscreen during your pregnancy to prevent, but then you have to use on the whole face because nothing has kicked in. And wish that, during the entire pregnancy time, it doesn't trigger in. Once you're during lactation, you can stop using the sunscreen.
Well, you have got your best possible answer. I believe the answer satisfies the person. We don't know your
Hmm.
name. But then let's move ahead, doctor. We had a wonderful chat about melasma today and how we can manage it. Well, I believe all the viewers could relate to all the answers which they have got today from you. Doctor, before we take a leave, any take home message for our viewers who has watched us so far?
Yes, it's actually not just for the viewers, but it's for everyone who is in the habit of going to chemists and taking medications from them.
Mm,
Most of the people who come with some kind of skin condition have actually applied or tried something at their home because skin conditions till now have been taken very lightly. Right. Even I would have taken them lightly, but since I've started seeing the kind of products chemists give to the general public, and to save 400, 500 rupees of consultation, someone plays with their own health and face, and then when things have gone really bad they come to us. It's a really sorry state, because what you save 400, 500 rupees, 1000 rupees, and now your treatment is going to cost 10 times what it was going to cost in the first place. So that kind of common sense, I feel, needs to be inculcated. Don't try to do things which you are not I cannot repair an air conditioner, right? I will have to call some kind of technician. Only that person can do it, and I'll have to pay him or her for it. I am not an engineer. So let's not try to be engineers and doctors by ourselves. Everybody has their own thing to do. Kindly stay
mm,
away from over the counter medications. They contain steroids. Steroids are used for actual medical conditions, they are not used on normal skin. That's what everybody needs to understand. But despite understanding, everybody still keeps on going and doing the same thing. So somewhere, it, more awareness about how bad things can go is required. And for that, I think a whole presentation about faces gone wrong with wrong treatments, those kind of things need to be shown to the people for them to realize. Other than that, if you feel you have melasma, go and visit a dermatologist. Don't self-medicate yourself. Even if you've tried till now, it's not too late. Just go now. Begin your actual protocol of treatment now. Get to know whether you're complete a full course of treatment, and you'll get to know whether melasma can be completely treated or not. Just trust your doctor. Right. And you do your own part. That is, use the medications as they have been told. Don't skip them. And do things in a protocol. Don't just do things haphazardly, and then get land yourself up in trouble, and then you come to the doctor later on. So use drugs, cosmetic products with careful intent is what I would like to say. Use them with careful intent.
right. Well, that was our expert advice for today, and that was Dr. Abhyuday Tiwari for all of us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers, and it was great to hear from you. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information, stay connected to our beautiful Spotless Skin page. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.